drug company Merck shared these study results in a press release, so I know you're still waiting, like everyone, to see the data. But if it is deemed safe and effective, which patients would benefit the most from this treatment?
Yeah, so this is, as you mentioned, preliminary, but it's really exciting information. We have vaccines, of course, that prevent infections, and we have some hospital treatments for people who have severe disease. But this new medicine is being proposed to treat people in the middle, in the early stages of infection, to prevent severe disease. What we know so far is that the study was conducted in adults, and these people had PCR-confirmed COVID-19 infection, and they had symptoms, and they had to have at least one comorbidity that's associated with having severe COVID-19. It's really exactly the kind of people we want to see a pill like this work in.
So let's get into specifics. How does it compare to those other treatments you're already using at the hospital? And do you foresee this maybe to help kind of ease some of the concerns, maybe for, I know, a lot of older folks out there who are fully vaccinated might be worried with Delta because, they're still at higher risk than many of the rest of us?
Yeah, so I think that the most important unique feature of this new medicine is that it comes in pill form. We do have other treatments that we use for people who are infected but not yet hospitalized. But these are monoclonal antibodies. These require injections of some kind. You have to usually come to a healthcare center to get those injections. So if these pills prove effective at treating people early after they get infected and preventing them from being hospitalized, it really could be a game changer.
So in terms of prevention, that sounds hypothetically great. Is there any evidence this pill could help patients who are already in the hospital, or at that point, would it be too late to take the pill?
So the makers of this medicine actually tested it in two groups of people. The people that we're seeing now, these outpatients who had early stage infection. There was also an earlier study they did in hospitalized patients. That study was actually terminated early. We don't actually have the results of that study, but it was terminated because it didn't appear to be working in people with severe advanced disease. So I think this is going to be a pill that they really focus on at the early stage of infection. And that makes the most sense because these antivirals will kill the virus. And we think the virus is what causes the earlier stages of the disease.
All right, there's a lot of concern out there because there's a lot of people taking a different pill. It's called ivermectin. And some people are buying it over the counter to treat or prevent COVID-19. It's not a COVID-19 treatment, we know, but what do you want people to know about that drug?
Yeah, so ivermectin has really been extensively studied for COVID-19, multiple randomized controlled trials. Unfortunately, some of those early trials were either actually fraudulent or not conducted very well. But now that we've seen some larger studies and some randomized controlled trials more recently, we have not really seen any data in support of this medicine helping people with COVID-19 really at any stage of the disease. So at this point, we just wouldn't recommend it's used for treatment unless you're being part of a randomized controlled trial. There's just no evidence that it really benefits people with COVID-19 infection.
Okay, Dr. Seidner from Mass General, thanks so much for sharing your time with us.
Anytime, my pleasure.